Good afternoon, and thank you for joining the 18th World Conference on Tobacco or Health webinar series. Today's webinar is titled Lessons in How Some Leading Parties Are Protecting Health Policies from Tobacco Industry Interference. Before we get started, I would like to go over a few features that will allow you to take part in today's event. When joining the webinar, you were prompted to set up your audio. By default, the platform selects your computer's microphone and speakers. If you prefer joining over the telephone, please select Phone Call in the audio pane and the dial-in information will be displayed. Please note that you are joining in a listen-only mode, which means that you are muted throughout the webinar. However, during our session, you will have the opportunity to engage with our panelists by submitting your text questions in the questions pane. You may send them at any time during the presentation. We will collect and address these questions during the Q&A segment at the end of our panelists' presentations. Now, without further ado, I am pleased to welcome our webinar moderator, Elif Dagli, Professor of Pediatric Pneumology from Turkey. She's also a dedicated tobacco control activist. She lectures on the health effect of tobacco, nicotine, and tobacco control strategies. She has served as an officer at the European Respiratory Society, the Union, and Turkish Thoracic Society. She's also a member of the American Thoracic Society Tobacco Action Committee. Elif has received the American Cancer Society Global Smoke-Free Partnership Award in 2009, the Union Honorary Membership in 2011, the Bloomberg Initiative Smoke-Free Award for representing a national coalition on tobacco or health in 2012, and the Luther Terry Award for Outstanding Leadership in 2018. Thank you very much, Elif, for joining us, and now it's over to you.
Thank you very much. Welcome you all, and it is my pleasure to introduce the speakers of today. This webinar is organized by the Union and the 18th World Conference on Tobacco Health, Scientific and Track Committees. I'm pleased to welcome the speakers on today's session, Dr. Stella Bülow, Mr. Ranjit C, and Dr. Maria Sunta. Our first speaker, Dr. Stella Aguinaga Bülow, is a native of Brazil and now lives in the United States, where she is a professor of University of California, San Francisco School of Nursing. She has been involved with WHO FCTC since the early development stages and is recognized as an international expert in monitoring the tobacco industry and developing strategies to counter the tobacco industry interference, including the implementation of Article 5.3 and its guidelines. She has provided technical assistance to countries in all regions of the world on countering tobacco industry interference and has published several articles in peer-reviewed journals. And I would sincerely like to thank her for waking up at a very early hour at her country, and we are indebted to our view of implementation of the WHO FCT and its impact on tobacco industry behavior. Floor is yours, Stella. Thank you.
Thank you, my dear Elif, and thank you to the Union and the conference for inviting me to participate. It's a bit early, but that's okay. The early bird gets the worm, as they say. So I'm happy to be here with all of you and all of our colleagues throughout the world. Next, please. I was asked to talk about the tobacco industry response to the FCTC, particularly as more and more governments and countries are preparing to really create that firewall between tobacco control and the tobacco industry interests, which is what Article 5.3 requires. But I want to remind everybody that the more it changes, the more the industry stays the same. And as someone who has been studying the history of the tobacco industry for a few decades and continue to look into it, we see that history repeats itself. So again, I want to continue to encourage all of our colleagues to reach out to other countries that have tried the same policies or have tried the same experience, because what we do know is that the industry will continue to present itself as a partner or as a collaborator. The industry will at the same time continue to oppose legislation as much as they can. Once opposition of this legislation fail, they will try to weaken the language of legislation, so make sure the legislation is not effective. If that doesn't succeed, the next strategy is to delay implementation as much as possible. And when implementation goes into place, they try to interfere with enforcement. And all with the goals of saying there's no need for tobacco control policies and legislation. Let's do voluntary agreements. We can control ourselves. So again, this is something we see over and over and over again across the world. Next, please. This is just a reminder, because as we are talking about Article 5.3 and the industry, I always like to this is what it actually says. It says that the parties of the FCTC shall act to protect the interests of tobacco control against commercial and other vested interests. So sometimes the interests of the tobacco industry might not be directly linked to a commercial gain. And that's okay. You still need to protect against that, because ultimately the interest of the tobacco industry and the industry's interests of public health do not combine. I would like to remind everybody that the FCTC is a whole of government approach. Ministries of health did not ratify the FCTC. The country is a state commitment. The entire country ratifies. So if you're reaching out to other departments and say, oh, but we don't do tobacco control, it's not our department. For example, if you're talking to some Ministry of Women or Education or Youth, everybody is, because the FCTC is a country level commitment, is not a Ministry of Health commitment. And we do know, unfortunately, that there are, as much as we're going to talk about some successes, there are some significant gaps in the implementation Article 5.3. Next, please. So this is, again, just to keep in mind that the better is tobacco control, the worse is for the tobacco industry. So the more the tobacco industry is opposing your measures, that means the more likely it is that these are good, effective measures and they're likely to succeed. Next, please. I like to bring back, this is an old quote. It's from 1995. The person that at the time was a senior vice president for worldwide regulatory affairs for Philip Morris International, now Philip Morris International. And it's just to remind that at that time, as it is now, the goal is to fight aggressively with all available resources against any attempt from any quarter to diminish our ability to manufacture products efficiently and market them effectively. Very little has changed since then. The goal is still, I mean, it is tobacco companies are by and large globally for profit. So their goal is to make a profit. They have a fiduciary duty to their shareholders. And that's where, if tobacco control is trying to reduce consumption, it's really hard to have a partnership with an industry that is trying to increase consumption. Next, please. So there are many examples. This is, again, just a reminder that the parties' commitment. So when we talked about Article 5.3 guidelines, which really give us a roadmap on how to go about preventing this interference, again, is a reminder that this was ratified by all parties. So you can't say that oh, my country said they disagree with it. Well, that time to disagree had passed. There was a robust discussion at the COP, at the Conference of the Parties, and everybody agreed to commit to these 8 recommendations on how countries can ensure that tobacco industry interference is minimized. I think what very important point for us to remember, and why the efforts to address this through ministries of health are a good progress, but is not sufficient, is that we know that the tobacco industry more and more target other levels of government that is not health. We are seeing enormous amount of efforts with revenue and customs, particularly on issues related to illicit trade, and very, very significant efforts, particularly in tobacco growing countries, to work with the ministries of agriculture. So again, the idea that this is just a health issue is insufficient, because the industry is going to really reach out to sectors of the government that is not health sector. And that's why it's important that we remember that the FCTC is a state commitment, is a whole of government commitment, as is implementation Article 5.3. There's no exception in the FCTC that say, oh, and this article is just for ministries of health. There isn't. The articles, all of them, the recommendations, all of them are for all of the government. Next, please. So some of the things that we are seeing throughout the world, and I think we're going to hear more very aggressively in the past 5 years, is bigger investment on this reduced harm, or so-called reduced harms. That's why the quotation marks, tobacco products. A continued and increasing use of litigation to oppose implementation of the FCTC. And we see that in countries all over the world, that once a country manages to pass legislation, including legislation that includes articles to implement Article 5.3, there will be litigation to delay. We just saw this happening with Uganda, for example, that had very excellent legislation and has been caught up in courts for a long time. And the industry continues to present itself as a partner to address illicit trade. So as more and more countries ratify the protocol and work together to stop illicit trade, the more and more the industry is investing in so-called solutions. But again, keep in mind that solutions for the industry might not be solutions for public health or tobacco control. So we always have to keep in mind, again, doesn't mean that they let go of some of these other older strategies. They're still fighting, for example, smoke-free environments, 100% smoke-free environments, which is something that by now it should be no controversy at all. We know it works, we know it's effective, we know 100%. So while they're still fighting some of these old battles, they are really going into this new products, and that is giving them a new platform for dialogue and to participate in decision making. Next, please. So I'm just going to say that there are a few models of countries that are implementing Article 5.3, and the ones that are doing very successful are building on existing institution and government structures. So reinventing the wheel is not always going to work. So make sure, for example, that might be transparency laws in your country, and all you're going to need to do is help government understand how they apply to the FCTC. That might be already rules of engagement with private companies and private sector. That might be existing codes of conduct or codes of ethics for civil service. That might already be bans or restrictions on corporate social responsibility activities as part of Article 13. So the models we are seeing that some of this is growing is looking at what existing institutional and governance structures are there that you can build upon and to create an implementation Article 5.3. And very briefly on the minutes that I have left. Next, please. Just a reminder that, for example, one of the guideline recommendations is establishing measures to limit interactions with the industry, that these measures be restricted to when interactions are necessary for regulation of the product. So no dinners, no can I have a meeting to present my research, only meetings when are necessary. And there's some guidance on how these meetings should occur. Next, please. And I like to highlight, for example, Australia as one country that had some guidance on public-private interaction and actually create a guidance that will be specific to the tobacco industry. So this is an example of using existing legal instruments and applying them and expanding to make sure it's in compliance with another legal instrument, which is the FCTC, because let's keep in mind that's a legal instrument. And Australia also has transparency in meetings rules. So we actually know when the industry is meeting with government, what is the agenda to the extent possible and who is present. Next, please. Another guideline recommendation is to avoid conflict of interest. And that is sometimes confusing, and sometimes government officials might be thinking that they are not in conflict of interest. So of course, it's important that we continue to educate and use infrastructure to educate the civil service about the rules. Next, please. Just 2 more. And so this is an example from Mexico where they actually use their own code of ethics. This is not just related to tobacco industry, but they create a very quick guide. So it's very easy for civil service to not engage in conflict of interest activities. And my last one. So these are some of the good news, that there is some increased awareness. For those of us that go, we hear much more about tobacco industry now than we did 20 years ago. Next, please. And I think going forward, these are some of the things we need to consider. In particular, I want to highlight the need for policy coherence to ensure a cross-sector implementation. Thank you very much.
Thank you very much, Stella. Great talk. The next talk will be about the experience of India in 5.3 implementation. And our speaker is Mr. Ranjit Singh. He is the attorney at law at the Supreme Court of India. He has been providing consultancy, support and guidance to Ministry of Health, Family and Welfare, Government of India. And also to National Institute of Cancer Prevention and Research and civil societies on tobacco control and other public health laws for more than a decade. He has specialization on litigation related to tobacco control, food safety, and standard laws. Mr. C has contributed in drafting laws on smoke-free public place, prohibiting on tobacco advertising, promotion, and sponsorship, regulation of display of tobacco products, and the usage in films, prohibition on sale of tobacco products to minors, prohibition on smokeless tobacco products, depiction of graphic health warnings covering of 85% on tobacco packs, and electronic nicotine delivery systems. He has drafted the law enforcers guidelines on tobacco control laws or government of India and has published several studies in the some journals and articles on tobacco control laws and litigations. It is my pleasure to give the floor to Mr. Ranjit Singh to talk on their experience in India. Please, Mr. Singh.
Thank you, Eli. So is my screen visible? Okay. So
yes, we can see it.
So yeah, so I think Stella has given quite a detailed account of Article 5.3 policy and you know, the development and what are the core principles of these policies. Now, sharing my experience from India. So just to and you know, and since I have been part of drafting most of the laws in the last 1 decade, so we have made some major stride in you know, as far as you know, graphic health warning is concerned, you know, covering 85% of the packs, then restricting tobacco depiction in movies and television, and now banning, we have a comprehensive law on banning electronic cigarettes. But as far as Article 5.3 and its implementation is concerned, it has not been a very smooth journey. And that's largely to do with India being one of the biggest producer exporters of tobacco. So there are different ministries, department that are involved, and those are the challenges. So while some are on board, some have issues about these things. Having said that, India has got a federal structure. So we have, just to brief you, before FCTC was adopted, India federals already had a law at the national level on tobacco control, as well as subnational law, or what we call state laws on tobacco control. And same principle we see now when it is when we talk about Article 5.3 implementation. And now we have both lessons from states as well as at the national level. Yeah, so I just to so rather not take this in detail. So we ratified FCTC on 5th Feb 2004, but in 2003 India has had its own national law, and there were several states that had their own state tobacco control laws. So we were already have had a comprehensive policy on tobacco control law, which had prohibition of smoking in public place, banning sale to a person below the age of 18 years, graphic health warnings, and no and the ban on taps, tobacco advertisements. So now like I said, while we were moving very smoothly and very at a great pace on other issues on tobacco control, whether it is your graphic health warning, whether it is your making public places smoke free, Article 5.3 implementation was slow, and this took a major leap in view of a public interest litigation, which was filed in one of the courts. And so in India, there's a policy that any person can go to a court and on any public interest issue can file. So in 2011, when the government was sponsoring an event, Global Tobacco Network Forum, in collaboration with tobacco companies, the litigation was filed, and the matter was taken to the court, saying that you have signed Article 5.3, and therefore you cannot have this kind of collaboration and sponsorship of these events. It's also in violation of your national law. So considering these, the government withdrew the sponsorship and also gave a commitment to develop a draft on code of conduct for public officials. So this was the positive outcome that came out, and that's when the buzz, I would say, started on implementation of Article 5.3 in India. And a draft was developed, which was possibly taken from experience of Philippines and some other, and discussions in the FCTC. And the core principles adopted in this draft, and which was circulated among different ministries, department. So health took the initiative, lead, and circulated to finance and commerce and other department, which considered to adopt this draft. So while this interaction was going on, where different ministries were being consulted, and there was a committee of secretaries from different ministries to come to a common ground on adopting this code of conduct, the India went ahead for banning electronic cigarettes. And at the same time, while this consultation was going on for banning, the Smokefree Foundation became very active in India. So a policy was adopted at the national level saying that we will not allow any government agency to partner with this, because we have a policy of banning electronic cigarettes. So Ministry of Health reached out to all state governments, to all central ministries, and said that you do not collaborate or engage with Foundation for Smoke Free. So this development happened sometime in 2017 to 2019. And in fact, one of the university that took a grant had to, terminate it because of the strict policy that the Ministry of Health adopted. And finally, last year they drafted the government at the national level for health ministry and for all the institutions that come under the health ministry, which is your whether it is at the national level or the sub-national level, a draft code of conduct was adopted, and which was circulated among all to implement it. So now you had a strict law, strict policy on ensuring that you do not specifically for Smokefree Foundation, and then you had a detailed code of conduct. But yes, there is this code of conduct was limited to health ministry and and the departments and agency that come under health ministry. It's not like other ministries also adopted it. But during the same time, like I said, India is a federal state. There is a lot of implementation, a lot of policies are also come into frame at the sub-national level. So we had already a bottoms-up approach which was going on, where state at the sub-national level started taking initiative in adopting a comprehensive code of conduct. So this code of conduct was not limited to health ministry. This code of conduct involved other ministries also, but this was at the sub-national level. And you had several states government. I think I have a list of 14, but it's much more. So out of around 30 states, you have at least 15 state governments that have adopted these code of conduct. And this code of conduct, one of the chief point is that they have an empowered committee in this who have a guideline as to how to interact with the tobacco industry and in what circumstances, and then there are detailed guidelines as to conflict of interest and other stuff. So my one major lessons that I would basically would like to point out is that if you are in a federal structure like India, if there are not very positive signs from the national level, then you can have state also take. So sometimes the sub-national level or state level becomes a guiding principle for the central government to adopt it. So the code of conduct, both at the central national level as well as sub-national level, have some, most of them have certain core principle, or like I say, salient feature, which is the objective and scope is defined, which means why this code of conduct is there. What is the scope means who all are covered under it, interaction with tobacco industry, when you should interact and in what manner you should interact, partnership and contribution you cannot have. So there are very clear this thing guideline, conflict of interest. What is conflict of interest? That is defined, and what and there are details given and instances given on when it is a conflict of interest. Then constitution of an empowered committee, which includes a member of different departments and ministries as well as civil societies. And lastly, a procedure is also given as for reporting violation and conducting inquiry. So these are certain core points that are there in these code of conducts, both at the one which is adopted at the national level by health ministry and by at the sub-national level by different states. So just to give you a quick example of the enforcement. So one of the states called the states of Karnataka. So one municipal corporation had a project with the tobacco industry on on waste management, but when the code of conduct was notified on in January 2019, that contract or MOU was terminated. So because of the conflict of interest clause. So this was a direct outcome of the day that at the sub-national level this policy was adopted, all such partnership got cancelled. This is a recent example during the time of COVID, where one of the representatives of the tobacco company was participating in an event on respiratory health. And this message, and since this institution that was organizing it comes under Ministry of Health, and they adopted this code of conduct. So it was highlighted to them that you look, this is, by the civil society, that this is in violation of your code of conduct. And the health ministry issued a notice to the organization, and this event was cancelled. So we have two instances of enforcement at both at the subnational and national level after adoption of this code of conduct. So, considering the paucity of time, and I would just say that this is only included. I have only included certain instances of the positive stories, but what Stella was trying to point out, the interference that you saw is not brought out. So we have massive litigation on every issue, whether it is graphic health warning, electronic ban on electronic cigarettes, and now when India is contemplating amending the National Tobacco Control Law, we have almost 1 million representation from tobacco industry not to do so. And so there are challenges, there are interference, these are happening, but there are also some, despite these odds, there are also some positive instances. And the best lessons to learn is that some sort of, some sort of implementation has happened both at the subnational and the national level. Obviously, we would see a day where, it is, since India has ratified FCTC, it is implemented across the country, but till it is, the lesson is that both, the state as well as the central governments have taken some positive steps towards implementing Article 5.3 guidelines. Thank you.
Thank you very much, Mr. Ranjit Singh. The next speaker is Mary Assunta, and she will talk about tobacco industry activities during the pandemic. Basically 5.3 and vaccine development and need for global solidarity. Dr. Mary Assunta is an international tobacco control advocate with more than 30 years of experience. She is the head of the research and advocacy at the Global Center for Good Governance in Tobacco Control, which is GGTC. GGTC is a partner of the STOP project. Mary is the senior policy advisor to South Asia Tobacco Control Alliance, SIETCA. She is from Malaysia and is now based in Sydney. She first went to Australia to do her PhD at the University of Sydney, where she spent 6 years reviewing the internal documents of tobacco industry, especially Philip Morris, BAT, and Japan Tobacco. She serves as an adjunct senior lecturer at the University, the School of Public Health. Mary is the lead author of the Global Tobacco Industry Interference Index and was the recipient of 2003 Luther Terry Award for Outstanding Individual Leadership in Tobacco Control. It is our pleasure to listen to Mary Assunta now. The floor is yours.
Thank you very much, Elif, for that very warm welcome and introduction. I hope you can all see my screen right now. And so I will just, right. Okay. So let's look at how some of the parties are protecting their tobacco control policies. And on behalf of GGTC, I want to express our thanks and gratitude for the opportunity to share our experience with us. So some of you would already be aware of the Global Tobacco Industry Interference Index. So, and this is released under the STOP project, and it's the information is compiled by GGTC. So in 2019, we released the first report, which covered 33 countries, and last year we released the second Global Tobacco Industry Interference Index, which of course, sorry, just, can you see my screen? Right.
Yes,
And
we
we
can.
released, yeah, and we released the second Global Tobacco Industry Interference Index last year. So basically, there are 2 points that I want to say, and that is the tobacco industry remains a problem, and it has stepped up its interference, and that's the findings of the interference index. And although the tobacco industry may publicly claim that it's a partner, it has changed, it is on the side of the solution, but really behind the scenes, as you know, and as you observed, it is really fighting tooth and nail to sabotage effective legislation. So through the index, we were able to document the instances of industry interference and also how governments were responding or were not responding to the interference. So the Global Tobacco Industry Interference Index basically is a shadow report, or you can call it a report card on how governments are performing in implementing FCTC Article 5.3. And so in this infographic, you more or less can see the countries that that were facing the most interference. And this infographic shows you that these countries are spread across the globe, and they also cover practically every region. So the take-home point here is that the industry will try to interfere at every instance possible. It's not confined to any single region or country. It really is something that it does across the globe. So what has the industry been up to in recent times, but particularly last year and the year before, based on the findings of the interference index? We know that the tobacco industry blocks and it delays effective legislation and government efforts to control tobacco control policy. And we have identified 3 issues that we find common across the globe. It fights against comprehensive, stringent legislation. This is the omnibus legislation. It'll fight against amendments and effort to strengthen those laws. It fights against tax increase. It also fights against any effort to ban new tobacco products. And so this would be your vaping products, the electronic cigarettes, heated tobacco products. Any effort towards banning them, it will fight and sabotage those efforts. So the important point here is for civil society particularly is to document the evidence, document the instances of interference, and provide the documentation to governments who can then support and advance their policy to implement the Article 5.3. The other thing that we found the industry doing, particularly last year during the COVID pandemic, is that it has stepped up its CSR activities. And on these 3 images here, you can see the example from Philip Morris. So on the left, you find Philip Morris boasting to its shareholders at its shareholders meeting in May 2020 that it donated 30 million across 62 markets, how it was supporting hospitals, crisis centers, trade partners, at-risk population. And here, in this slide, which is also from the Philip Morris presentation, it has named all the countries, practically just a few of those countries, where it has handed out some of its PPEs and also equipment to the health sector. So, but what is really more disturbing is that you would have heard of Medicargo, which is the pharmaceutical company based in Canada, which has got now an MOU to provide vaccines to the Canadian government. When Philip Morris owns 1/3 of Medicargo, and that is indeed a problem, because the moment the Canadian government announced this, then Philip Morris quickly put forward, released a statement, associating itself with this initiative and how it's involved in vaccine. And I'm sure you've also heard of BAT also investing in vaccine development for COVID. So these present problems, and they are 5.3 issues which need to be addressed. So transparency matters. We found that the past couple of years, several governments have actually signed MOUs with the tobacco industry to tackle particularly smuggling. And it's interesting to note that the parties that actually signed the MOU are actually, they are non-parties to the protocol on illicit trade. So it is important for governments to actually ratify the protocol so that they don't have to make those side MOUs and agreements with the tobacco industry. We also found that countries that fared well, or other countries that faced lesser interference, were countries that operated in a transparent manner when they had to deal with the tobacco industry, which means that they were able to record the interactions, or they were able to record political donations, or all of their meetings are announced beforehand, with the industry is announced beforehand, available on their websites. So basically, the take-home point here is that transparency matters. So on this slide, you can see that countries with the least interference from the tobacco industry, I've just given 5 examples here: Brunei Darussalam, France, Uganda, United Kingdom, and New Zealand. So in our survey of 57 countries, these were the top 5 countries that faced the least interference. So with that in mind, basically how governments can protect themselves, as you've heard in the previous presentations, would be to be transparent when interacting with the tobacco industry, for governments to put a firewall around their officials, particularly through rules of engagement, and this can be in the form of code of conduct or guidelines or directives, all based on the principles of Article 5.3. And of course, to increase awareness across government agencies about tobacco industry tactics, because as we have seen, while ministries of health are diligent in monitoring and really taking care that they are careful in their interactions, the tobacco industry will interfere via other non-health agencies and departments. So what did countries do right? And so here, as we have heard previously, it's important for governments to take a whole of government approach when they set their firewall, or when they set out to put those guidelines in place, so that the whole of government is protected. And I've provided 5 examples here from Uganda, United Kingdom, Australia, Philippines, and Brunei. So for Uganda, their Article 5.3 component is actually integrated into their Tobacco Control Act of 2015, and I'll talk a little bit more about that. The United Kingdom and Australia have got guidelines. For the United Kingdom, they revised their guidelines for their overseas posts, to provide guidance on how to handle interaction with the tobacco industry. And this is basically refers to their diplomatic missions abroad. For Australia, it is a guidance that on interacting with the tobacco industry. For both the Philippines and Brunei, they are joint, they are circulars. So the Philippines circular is a joint memorandum circular between the Philippines Civil Service Commission and the Department of Health. And this is a good one because it covers all civil servants, including diplomats. And Brunei, it was their Prime Minister's department that issued a circular. I want to quickly go into some degree of detail for the Uganda experience, because as I mentioned, it's one of the toughest protection that I've seen on Article 5.3 integrated into their national legislation. And so this is 2015. And there you go, in November 2016, BAT filed a petition against the government of Uganda's contesting this component, saying that's against the constitution of the Tobacco Control Act, and pinpointed the Part 8, which is on Article 5.3. And so the state attorney dismissed the injunction, saying that it had no justification. The petition appeared to have been misconceived or brought in bad faith, as part of a global strategy to fight tobacco control legislation. And the court awarded costs to the government. So for 3 years then, since the law was passed, the Uganda government efforts to enact regulations to implement the laws were therefore delayed. And in September 2019, the Tobacco Control Act regulations were then gazetted for effective implementation. And the following January of 2020, the tobacco industry, BAT, and other companies filed a temporary injunction against the enforcement of these tobacco control regulations. And then they had to go to court, and again, then the injunction was made ineffective because the Ministry of Health then issued a letter directing that the extension of the commencement of the regulations was actually shifted from 1st February to the 1st April. So basically, BAT and company and the others failed in their second lawsuit, but you can imagine that they're not going to stop there. So I want to pinpoint to the UK guidelines for overseas posts, which is a really good one. Some of you may be aware that by the way, this guidelines was actually enacted in, or rather adopted in December 2013. In 2014, at the COP in Moscow, the governments agreed that Article 5.3 should really also cover the diplomatic missions. So this UK guidelines is really quite important because it limits the interaction of their diplomats, against the tobacco from the tobacco industry, and also whenever any such interaction has to take place, it's got to be conducted in a transparent manner. What the the diplomatic missions mustn't do is they must not be involved in promoting the sale of tobacco or tobacco-related products. They also must not encourage investments in the tobacco industry or provide any assistance to influence policies to their advantage, policies such as taxation, plain packaging, pictorial warnings, etc. And I'm pinpointing this particular point because of what actually happened. So now you know that guidelines was issued in 2013. So in 2015 in Pakistan, the UK High Commissioner was accused of lobbying for the cigarette companies in Pakistan, particularly BAT. So this was exposed in the newspapers. In 2017 in Bangladesh, a British diplomat had lobbied on behalf of the tobacco companies, and this again was exposed in the newspapers. And the High Commissioner was accused of helping BAT to fight Bangladesh demand for 170 million pounds in unpaid VAT. So it wasn't just this kind of interference through the embassy. It didn't just happen in these two countries. It also happened in Panama in 2015 on the issue of e-cigarettes and tax, and in Hungary also in 2015 on tax. So the point here is that it's really important the role that civil society plays to monitor such instances and to document them and also to ensure that they get exposed, because it is only when they expose then that something is done. So it's not just enough to have the guidance and the codes. They really need to be implemented. Again, on the subject of what governments did right, let's look at countries where the Ministry of Health has taken the first step to protect their health officials by adopting some measures based on Article 5.3. So here I've listed 4 countries. You have heard the example of India from Mr. Ranjit. In Lao PDR, the Ministry of Health has got a code for the health sector. In Myanmar, similarly, it is also guidelines, and Thailand, it's also guidelines. And Thailand, of course, is at the moment in the process of extending from the Ministry of Health to whole of government. So regard the Ministry of Health efforts when they have a code just for Ministry of Health, that is the first step in a 2-step process, and then it should be extended to cover other departments. So just I will skip this slide on India because it's already been covered in detail by Mr. Ranjit, and go straight to Myanmar. So while the Ministry of Health and Sports in Myanmar has got a code covering its health officials, BAT has worked through Eurocham, and so Eurocham Myanmar then goes to the government, and of course not the Department of Health, but the Department of Commerce, Department of International Trade, and makes an MOU or an agreement with the government to provide assistance to tackle illicit trade and to promote development of the country. So you can see how they use the trade organization and use buzzwords, you know, like development and investments, and then to have agreements with the government. And this really puts the Department of Health in a difficult situation. So hence you can see really the importance of if only Ministry of Health officials are covered, you really need to extend it to the whole of government. So I'd like to conclude by saying that really it is in the hands of governments to address tobacco industry interference and to take a holistic approach. All the details are provided for in the guidelines. There are examples that I've shown that you can adopt from countries that would best suit your own need. And final comment would be that the GGTC also houses the Knowledge Hub for Article 5.3. And the Knowledge Hub offers a course on FCTC Article 5.3, and I would strongly recommend you to register and to take the course, because it will walk you through the guidelines in a very easy to understand manner, and to learn how to apply the guidelines in various situations. So I would strongly encourage you to do that, and also to visit the website of the STOP project that is in exposetobacco.org, and also to find out more details about the Global Tobacco Industry Interference Index from the globaltobaccoindex.org. With that, thank you very much, and I welcome your comments and questions. Over to you, Elif.
Thank you very much. That was a great talk. Thank you, Maria Sunta, as always. Now it is time for questions, and from the questions, I've seen that Florence Bertoletti has some questions. She's one of the giants in tobacco control. Apparently she's with us again. But now I will hand over to my co-chair, Pranay Lal, to take the questions. Thank you very much to all the speakers.
Thank you very much to all our panelists. We are now going to answer the questions that have been submitted thus far. Please note that you can still submit questions via the questions pane. I'm going to go to the first question that was submitted by Nasiruddin Ahmad, and I think this is a question which is directed towards both Mary and Stella. Now, what Mr. Ahmed says is that tobacco industry uses conflict of interest to approach policymakers. What are the strategies and that we need to use to overcome the challenge of conflict of interest? I mean, briefly, if you could say something that you have already said in your slides, but if there's something that you would like to address further. Mary, first you, and then Stella.
Thank you very much. I'd like to say that the interference is not only through conflict of interest. There are other situations as well, but conflict of interest definitely is one of them. So again, the guidelines has got some details on how to go about it, but I'd like to give two examples. One, there are instances where governments actually invest their social security system funds is invested in tobacco companies, so they need to actually divest, and that's one of the conflict of interest that needs to happen. Also, you will find that the tobacco companies like to recruit senior government officials who have retired, you know, whether they are attorney generals or whether they are ministers, and even presidents, you know, have been recruited. So then governments need to have a policy called an exit policy. In other words, once they've exited or retired from the government, to have a policy that they would not work for the tobacco industry for up to a certain period of time. For GGTC, our policy would be 5 years. As a starting point. So I'd like to just briefly give these two examples. Stella, you may have other suggestions.
Yeah, I agree that is a challenge, and it's a challenge particularly in countries where existing laws related to conflict of interest, existing guidance is not being enforced. So I would encourage everybody to look what you have, compare with the guidelines, and realize where the gaps are, because the gaps is what you're going to need to address. And if you don't find gaps, what you really need is an education campaign to civil service about why having this conflict of interest is hurting the country tobacco control, hurting the social and economic development, not just the health.
Great point. The next question, I think, is directed to Mary. This, I think, appeared when you were making a presentation about the index.
Mm-hmm.
And Shankar from Empower India has this question. May I know why no data is there for Indian industry? I think it refers to the map that you had shown, so where you spoke about Georgia and Jordan and other places. So
Yes, and the question is, why no?
why is there no mention of India or the Indian industries in your presentation?
All right. Okay. So the infographic shows like the top, the worst 10 and then the best 5. So that means that India is not at the bottom and neither is it at the top. So basically that's what it means. So if you want to know exactly the ranking of India, I think often I recall that India is somewhere in the middle. So if you visit the globaltobaccoindex.org, you'll be able to get the exact ranking of India. And I hope that the score for India would improve this year. So we'll be repeating the index this year. So really, I want to see an improvement for India, particularly because of the guidelines that India now has.
Thank you, Mary. The next question also is for you, Mary, and also I think Ranjit. This is from Florence Bertoletti. She thanks the presenters for a fabulous presentation. What her question is that we've heard good progress that has taken place at the executive level, but are there any examples of success stories regarding implementation at the legislative level? Anyone from the panel? Any examples from the judiciary? Ranjit?
So India is very clear on separation of power. So neither the judiciary nor the legislative nor the they meddle with it. But time and again, like I started with with my presentation, that all this the process in India about Article 5.3 started with the judicial intervention in one of the cases, and then it developed from the state to and this. So we've not had example from judiciary, but yes, there have been attempts to include it in the national law. There have been attempts to like you say, like Uganda has done. They've tried to include Article 5.3 in the Tobacco Control Act itself. So there were attempts, but yes, there were, like I said, also that due to massive tobacco industries, presentations, the entire process got scuttled, which is now again revived after 5 years, and the efforts are going on. But to put it simply, there is no major this thing from the legislative thing. These are mostly executive orders, but the good point about is that considering the huge population of India and the enforcement challenges which we face because of lack of whether the penalty or whatever the prosecution or something, the development at the grassroots level is where the enforcement starts, and these orders which are also being issued with at the lowest level, right from the district to to the states to and then to the national. So this is some approach which is, I think, is somehow different from other countries, that the lowest level where the interference can happen, some progress is being made there, and then it comes to the national level. So it's kind of a bottom-up approach for India, which would be considering the challenges in enforcement great.
So very quickly, I would say that transparency is an important point. There are several countries that have got, register for lobbyists and also to declare political contributions. I think that is a starting point. Thank you.
Thank you, Mary. Again, a follow-up question by Florence from, I think, Mary and Stella. Is there more interference in countries where tobacco is produced? Just very rapid response.
I think that, well, short answer, yes. And the point that it's very convenient for the tobacco companies to hide behind the farmers and always put them in front as an excuse, for fighting legislation. So this happens quite a bit in countries, where tobacco is grown. So that would be the short answer. Yep. So yes, tobacco companies pay farmers very little, but they make use of them to fight legislation.
Okay, I'm going to be quite brutal because I can see the deadly hand of the watch. So I'm going to take this question. I'm going to skip a few questions that have been asked and take this one out of turn. There's a question for you, Mary, from Pavel Antonov, and he says, how could we get the EU to adapt similar guidelines for diplomats as the UK's? What is GGTC strategy? What are we doing?
Thank you very much for that question. I'm very glad you've asked it. So to me, that indicates that you're interested to do something. So I think this is very much in the hands of civil society. And there are some great advocacy groups in Europe. Work with them closely. And I think that you can get the EU. So you've got to look at document the instances of interference so that you can make a strong case for the adoption of a code similar to what the UK has adopted.
Okay, again, a question on the EU by Victor Kovacs. He has a question about harm reduction, and he wants to know what do you advise on how we could minimize tobacco industry interference in the EU, given that there is intensive marketing of products labeled as being safer, like snus, and what is it that you recommend to advocates like Victor Kovacs?
I would
Stella,
say,
Mary.
sorry, go ahead, Stella.
I was just briefly gonna remind everybody that these novel tobacco products are tobacco products, and all the articles of the FCTC should be applied when regulating. So if a country decides that they're gonna allow these novel products in the market, it's a country's prerogative to make that decision. But if they do, should be Article 13, banning marketing, advertisement, sponsorship that shouldn't be used in public, etc., etc. So all the measures of the FCTC should be applicable, including taxation.
Mary.
I was just going to say something similar, and to say that WHO provides good guidance that tobacco in any form is harmful, so that you should apply that principle.
Excellent. I don't know how we are doing with time, but I think we're over.
Yes, we are running really over time, and we need to close now the session.
Okay.
I'm not sure if. Thank you very much. Thank you for our speakers. I'm not sure if Elif, did you have any closing remarks for us?
I would like to thank everybody who took part in this great session. And it was an excellent way of presenting. And I would say good morning, good evening, and thank you very much to Mary and Stella and Ranjit.
It's our pleasure. Thank you very much for the opportunity. Thank you.
Thank you all for attending today's webinar organized by the Union and the 18th World Conference on Tobacco or Health Scientific and Track Committees. At the end of the session, you will receive a survey. Please don't hesitate to complete it because your feedback is important to us. The recording of this webinar will be available on the Union YouTube channel, and all the registrants will receive it through an email. It will also be available on the Tobacco-Induced Diseases website landing page. The registration for the Leadership Summit on Tobacco Control is now open. Don't hesitate to visit our website, wctoh.org, to register and know more about this event and our activities. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you.
Thank you. Bye-bye.